Hi, I'm Dr. Albert Campana. I'm a chiropractor here in Barnegat. I've been practicing for about 30 years. I've treated over 6,000 patients. In fact, I have a family of 7 chiropractors. What I want to go over today is the 9 steps to a healthy back. Now, these are procedures that are used on patients who've got like bulging disc, herniated disc, spinal stenosis, degenerative arthritis, degenerative disc disease, failed surgery, loss of the cervical curve in the neck, foraminal encroachments, things that really need some additional work to be done on them. What I like to do is go over all those steps. Typically, a patient will start with electric muscle stim to say the lower back, hot pack, or maybe an ice pack, some spinal manipulation, and then we come over into this room. And what I've done is designed an area where we have physical therapy and chiropractic together. I think by adding the 2 professions together, you're just going to get better that much faster. We start off with a flexion machine for the lower back. It's almost like a sit-up, but it's kind of designed a little differently. It's designed to open up the lower back and separate the vertebrae and strengthen the stomach and the lower back muscles at the same time. Basically, the patient will just stand along here, cross their arms, and go straight down. And what it's doing is actually opening up and separating each vertebrae. When you do get a little bit stronger, you can add weights to it. And basically just by handling the handle and then straight up and down. Okay? The next machine I like to go to is basically it's for the entire pelvic area. There's 4 things we do with each leg. Forward flexion. Again, the weights are adjustable and so is the height. Extension. Then we do abduction and adduction. Of course, we do both legs. We do about 5, 10, 15, depending on a patient how strong they're getting. Next, we go to the wobble chair. The wobble chair basically does a lot of things. You just go ahead and sit in, and you kind of roll your butt on the bottom of the chair in circular, counterclockwise, clockwise, figure 8s, almost anything that you can think of doing. And what it's doing is you're actually adjusting the spine, increasing the fluids to the disc, separating the vertebrae, the facet joints, and stuff like that. It really loosens you up real nice. I use it all the time before I play golf. In fact, all this stuff that helps the golfer. Next, we go to what we call the whole body vibration. Now, this is something new that's out there in the market. You would just stand on this thing, and it vibrates, but you're making 3,000 muscle contractions for each minute that you're on it. Not to skip any of the benefits, I want to read some of the stuff it does. It increases your human growth hormone output by 460%, builds bone density and fights osteoporosis, increases your basal metabolic rate, reduces back and joint pain, decreases blood pressure, elevates your serotonin levels for better mood and sense of well-being, improves both circulation and lymphatic drainage, decreases your recovery time after workouts, increases your muscle strength up to 50% in as little as 3 weeks, dramatically increases your flexibility, heightens your sense of balance and improved coordination, tone and tighten skin. Okay? So, it has quite a bit of benefit. Next, I want to move on to if you were a neck and shoulder person, we'd go ahead and go into this machine here. We put the neck through all 4 ranges of motion: flexion, extension, and left and right lateral flexion. We have 65 ligaments in the neck. We also have 4 layers of muscle on there. And basically, you just sit in the chair and just kind of move the head accordingly to whatever direction you want. We also go on to moving into what we call an over-the-door traction unit. Years ago, we used to use water or sand. Nice thing about it right now, we're using a device that is really controlled by your own body weight. You kind of like just slip it onto your head, palms facing yourself, and then you kind of just drop your body. Now we hold it for about 10, 15 seconds. What it does, it's opening up each vertebrae, separating each vertebrae, allowing the disc fluids to get sent in there. Takes pressure off the brachial plexus that goes down to the arms, into the neck area. Next, I want to move on to what we call cold laser therapy. This is a light therapy. It's one of the best machines on the market. It's got 32 diodes. Typically, some of them only have 4 or 6. It penetrates about 4 centimeters into the body. It's solely painless. The only thing is not supposed to look at it directly, but you can put it almost anywhere you want. TMJ joints, a shoulder joint, a knee joint, lower back. Basically, it's very good for healing the disc. I'll give you some of the benefits of that so I don't leave anything out. Relieves pain by producing endorphins, increases cellular energy, increases healing, decreases inflammation, speeds bone repair, speeds connective tissue repair, relaxes muscles, stops spasms, decreases swelling, enhances the immune system, and DNA repair. Now the best table that we have nowadays for the herniated disc, the bulging disc, the spinal stenosis, the degenerative joint disease, people who failed surgery, is the spinal decompression. You may have heard some of this in the news lately. What I have here is a DTS table. It's the most popular one in the profession. It can not only do the lower back, but also does the neck. It's a FDA-approved pulley system that runs a method of it kind of pulls and releases and pulls and releases, 30 seconds, 1 minute type of thing. What I want to do now is review the 9 steps real fast, and then I'm going to have you watch a video on the table itself. The 9 steps that we do, again, is going to be the spinal manipulation, the muscle stim, a hot pack, maybe an ice pack. We got 2 different rehab equipments here for the lower back. We got the wobble, the over-door traction, the cervical traction, the whole body vibration, the cold level laser therapy, and of course the decompression table. All right, so now we're going to have you watch the video on the decompression table, and any questions, I'll talk to you later. Thank you.
I think the back pain affects all qualities of life.
I would be, I'm sure, very irritable and not much fun to be around.
My back pain keeps me from doing things that I normally do.
I was actually training for a marathon.
Overall, it keeps me kind of slowed down.
Used to be able to run, 25, 26 miles, and it was reduced down to maybe 3.
I would have to take too many over-the-counter medications.
It gets to the point where sometimes it's a shooting pain.
A constant ache.
Down the back of my leg and a lot of discomfort.
Causes headaches, and I have difficulty turning my neck.
It's just always there, and there's always an underlayment of pain that rises and comes back daily.
Frustrated with back pain? Feeling like you're enduring life rather than enjoying it? Well, you're not alone. More than 65 million Americans will experience back problems this year. Only the common cold causes more people to miss work. And you're not alone if you've spent hundreds or even thousands of dollars on treatments and medication. This year alone, Americans will spend more than $50 billion treating back and neck-related pain, many times only experiencing temporary relief. What if you could finally get more permanent relief? What if there was an alternative to medication, painful exercises, bed rests, and surgery? What if you could finally enjoy your life again? The great news is, you can. How? With DTS spinal decompression therapy, a leading non-surgical alternative for disc-related syndromes of the lumbar and cervical spine. This comprehensive treatment has already proven effective for back pain sufferers around the world. In fact, many patients feel relief after their very first therapy session, and some 7 out of 10 patients who complete their treatments walk away with their back pain totally eliminated. So you're not alone in your back pain, and now you're not alone in starting this exciting new therapy. You're joining thousands of people who are experiencing back pain relief thanks to DTS spinal decompression therapy, the safe, comfortable, and long-term solution to your back pain.
Every time I come out the DTS table, I do feel much better.
I think it can have a great impact on a lot of people's lives, just like it has on mine.
There is a therapy that can help those problems in their neck without surgery, without drugs, that's safe, and it works.
You can feel confident knowing that the developer of this revolutionary decompressive treatment is the world leader in physical therapy equipment design, with over 8,000 systems installed worldwide. Although DTS systems have primarily been used in hospitals, now, through advancements in manufacturing technology, DTS therapy is also available in many clinics and private practices. In many cases, back pain is the result of an accident or injury. In others, pain has resulted from day-to-day stress and simply develops over time.
I always attribute it to just getting older. One of the things that I assumed everyone went through. And then when I realized that it's actually a compression problem in my neck, that I don't have to feel like that.
In order to understand what makes DTS spinal decompression therapy so effective, it is important to first understand the structure of the spine and the discs of the back. In the simplest terms, over the years, the spinal discs of your back and neck take the brunt of the compressive forces of gravity and stress. Small, minute tears in the outer structures create weakness in the discs. When stresses due to movements or an injury increase the disc pressures, a failure of the shock-absorbing qualities of the disc cause pain and muscle spasm. Although muscle spasm is the body's way of dealing with instability of the spine, it causes excruciating pain.
I could not even stand up straight, or even I had a hunchover. I couldn't move this leg, period.
There were days where I would almost be in tears, my back hurt so bad.
DTS is a comprehensive treatment plan which uniquely addresses your back pain through 3 phases of therapy. Typically, the sessions last less than 20 minutes, and, unlike other alternatives, your comfort and safety are of primary importance. In fact, in order for DTS therapy to achieve the ultimate objective of complete rehabilitation, you must be 100% comfortable.
It's wonderful. It doesn't hurt. In fact, at one time I fell asleep while I was having the DTS therapy.
Let's get started. Decompression therapy is delivered utilizing the table, traction motor, and a specially designed belting system. Our trained staff will place you in a custom-designed harness while fully clothed and adjust the harness to fit your body size and shape. Again, at no time should the treatment be uncomfortable or painful. Once the computer traction device is set, the treatment begins with a very gentle progression towards a decompressive or what might feel like an anti-gravity state for your spine. While you're lying in a relaxed and comfortable position, the DTS system does the work, stretching and distracting the spinal column, creating a vacuum effect that decompresses the discs within the column. This vacuum can, in many cases, help retract or draw in the herniated disc that may be pinching a nerve. Most patients report this as a comfortable, stretching sensation.
It feels like a very gentle tug, almost like what it would feel like if I were hanging upside down and stretching out my neck just from the weight of my head.
The first phase of the treatment should give you dramatic reduction of your painful symptoms.
When it was done, I got the table, I was like, wow, that feels really great. My back was really loose, and it just felt great all the way from here down, which normally is pretty tight.
I haven't had a pinched nerve since I started this.
The primary goal is to get you as pain-free as possible, and then introduce much-needed mobility to your spinal column. The decompressive portion of the DTS therapy system creates negative pressures or a non-compressive state to the discs, helping to bring blood supply and nutrients to the discs to begin the healing process. Our initial goal is to restore the body's own healing mechanisms that are temporarily lost during the acute phase of injury. Placing your spine in a decompressive state will help take the pressure off the nerves that are causing you pain. The treatments last anywhere from 15 to 20 minutes. Your technician will then let you rest quietly and will return at the completion of the therapy session. If you are uncomfortable for any reason, you have the ability to immediately stop the treatments with a press of a button. When your doctor feels your spinal discs and the muscles that support them are stable enough to start the biofeedback-based core exercise and strengthening program, you will proceed to the next phase of DTS therapy. Fortunately, your painful symptoms may be substantially reduced by this point, but the structures supporting the spine are still in need of repair and retraining. And again, this is crucial for long-term recovery. And that is why it is necessary to continue with the exercise and stabilization portion of the DTS spinal decompression therapy.
On an ongoing basis, as I repeat the therapy, my neck will actually get stronger and the problem might correct itself without any other treatment.
From this point forward and leading into phase 3, you will be performing the exercises in our clinic and at your home. Continued blood supply, enhanced by decompression of the discs, is ultimately what promotes healing to the damaged structures of the spine. Remember, this is a treatment plan with the goal of long-term recovery. Even though the pain you originally felt may finally be gone, that is not an indicator that you are fully healed. The damage may go much deeper, and the process of healing your back takes time. Therefore, you'll need to continue your home-based exercises daily for a length of time. Restoring you to the lifestyle you've been missing is our goal. Utilizing the most current technology in decompressive therapy and focused rehabilitation is the foundation of DTS spinal decompression therapy. Together, we hope to return you to the function and lifestyle you desire. This is our highest priority.